You ever had those days where you feel like you just bring bad luck to the patient? Well, I'm having one of those weekends. Hi, this is John Adams, the Rehab and Documentation Guru. So, this was my weekend to work. Usually, that does not mean a Sunday admission, but this time it happened. And I had a patient admitted by me, revision total hip. Guy he had like a 30-year history of having hip replacements. His first one lasted 10 years, and then his second one lasted almost 20 years, but then it got infected, which is kind of strange. Like, you wouldn't expect a long-standing hip to get infected, but it did. And then he ended up with a spacer put in, antibiotic spacer, earlier this year, and then went in this week to have his hip redone. Nice guy. I'm working with him. He's doing great. Huge incision. Huge. And done at a hospital that's different than the ones I usually get from, but they handle like cases like him that are higher risk. And anyway, we got done with the almost done with the evaluation, and I'm walking him, and we're practicing stairs, and anyway, he's doing great, and I wasn't like stressing him. I don't stress my joints. I do not stress my joints. When they're first out of the hospital, I just want them comfortable. I want to get the edema out, make sure they're doing their easy exercises, and then we'll progress them. But anyway, we're yucking it up. His wife's walking with us, and all of a sudden I hear his wife, who is behind us, go, "Ooh." And I look down, and there's just blood just gushing down his leg. I mean, it probably wasn't as bad as it looked. And I always know that blood volume, when you like mop it up and stuff, it looks worse than it really is. And I mean, all told, he probably lost 3 to 4 ounces while I was there. Not very much. But anyway, he's just got blood just coming down his leg. And he had shorts on. We're outside, but it's a fairly private area, so we whip down his shorts carefully. And we can see that mid-incision, where he's got this dressing that it was supposed to remain on from the hospital, massive collection of blood just weeping outside the bandage. And so I asked the wife to grab something. She grabs paper towels, and I tell her to put pressure on it. Called EMS right away, because this, with this guy's history, I'll tell you, he also had a history of an infection in another part of his body. Not to give too much detail, but he had to have a bone removed because of that infection. So this guy clearly has a huge infection history. And so you got to wonder, like, when a wound just suddenly apparently dehisces, I couldn't see it, is there an infection going on? And I used to be able to brag that in my time as a therapist, I only saw one wound dehiss in a clinical setting. That was to one of my coworkers who was working on stairs with a knee replacement, and the lady's knee dehissed while on the stairs, and badly. That was terrible. So anyway, called 911, and we were able to staunch the blood after about 15 minutes. It seemed to basically stop, but sent him to the hospital. I'm sitting with him. I'm trying to like make light of it, because I know the wife's there, and she seemed pretty calm. But women. Here's the thing about women. Okay, guys, pay attention. Women are tougher when they're the patients. Women are not as tough as guys when they aren't the patient, because they worry more for the other person than generally themselves. Time and again, women have proven to be a tougher patient, and the guys are wusses. But when somebody else is suffering, the woman suffers too. And ladies, you could back me up on that. And so anyway, I was just yucking up with him. He's like smiling, laughing a little bit, because he wasn't in pain. It wasn't. I asked him, "Are you dizzy?" I was concerned he might get faint just from the loss of blood. Not from the amount, but just seeing it. Like, some people get really woozy when they see a lot of blood coming out of them. And he was fine. He's a pretty tough character. He's been through a lot. And so anyway, he's sitting down, we're talking, and EMS shows up after about 15 minutes. They obviously went to the wrong house, because we could hear them coming in the background, and then it faded. And the lady's like, oh, maybe that was a different ambulance. And then I'm like, eh. I bet they got lost because this is a big lake community. And sure enough, I could hear a diesel truck like driving slowly towards our area, and I knew it was an ambulance. And anyway, they took over and got him to the hospital. But this has been my weekend from hell. Out of 3 patients, I sent 2 out to the hospital. And the third one, I kind of debated sending to the hospital because I wasn't sure if she had a pulmonary embolism because she was breathing really heavy, but she said that was her baseline. And so the nurse called her later on just to make sure she was okay. But what a weekend. Do you ever feel like you're the bad omen? Like, that was one of the things I was joking with the patient about, was the fact that I had sent a patient the other day to the hospital, and maybe I shouldn't have been the therapist coming out. And we both chuckled about that. I'm just like the bad omen. Bad juju, as the patient's wife put it. Anyway, John Adams, the Rehab and Documentation Guru. Hoping you're having a great weekend. Better than me and my patients. Take care and God bless.